about chronic arterial stenosis in the leg. Let's have a look at what are the features of chronic arterial stenosis in the leg. The first and foremost and the most important is intermittent claudication. Points that you must remember about this is that it's a debilitating type of pain and cramping pain, precipitated by walking, but there's a but here, not present with the first step. Unlike osteoarthritis, okay, or various other situations also, and relieved on taking rest. Within 5 minutes. That's also a thing that you must remember. If it takes greater than 5 minutes, it may be osteoarthritis or a disc prolapse if there is greater than 5 minutes. Or think of any other cause, but not intermittent claudication. That you should be very clear in your head. Next thing is rest pain. Now the name implies that the rest pain means pain during the rest. That's so simple. But why? Why rest pain? What's going on? So what's going on is that there is critical stenosis here. And as a result, there is anaerobic metabolism even at rest. So that produces pain. Okay, so what will the patient say to you? Pain aggravated during the night. When he lies down and relieved by sitting on a chair with legs hanging. Now why is that? Why is that? That's because when the limbs are hanging, the gravitational force aids in perfusion, thus bringing about a bit of relief. Okay, then we come to the next symptom, and that will be ulceration or gangrene. Now the ulcers in such a leg, chronic ischemic leg, the ulcers are generally shallow and non-healing type, mainly present on the dorsum of foot or shin of tibia or malleoli. And gangrene, you all can identify what's gangrene, I think. And if there is secondary infection, it can turn into a wet gangrene. Now, such a limb, you must be very clear that there is critical stenosis. And the patient is in need of urgent assessment and intervention. Okay. Next, what we should talk about. You must also assess about the color, the temperature, the sensation and movement of such limbs. Okay, let me highlight that for you. Color, temperature, sensation and movement. Color. Now, in an acute limb, the limb will be pale. But here we have a different scenario. In chronic limb, we get a dependent foot sign, dependent rubber, sorry. You get dependent rubber or a sunset foot sign. I shall be talking about this in detail again. Dependent rubber or sunset foot sign. What's that? Here, when the patient is sitting by, hanging his legs below the chair, the limbs may turn red, and if the clinician is not very careful, he may even confuse this with cellulitis. But only when you ask the patient to elevate his leg after lying down, there will be venous guttering and there will be pallor of the leg. So that's it. There will be venous guttering on elevation of the leg, and then the limb will turn pale. So that's about color. Now about temperature. A chronic ischemic limb generally very well takes the temperature of the surroundings. It can be warm if it is within the warm sheets, covered within the warm sheets. Sensation is generally intact in chronic ischemia. And then we need to talk about the arterial pulses. In all such cases, we need to feel the arterial pulses, namely the femoral, popliteal, the posterior tibial, anterior tibial, and the dorsalis pedis. Now, I'm not going to describe all where do you need to feel these pulses, but I would like to emphasize that when you are palpating for femoral popliteal artery, you need to compare with the other side, and then you can document that whether they are diminished as compared to the other side. And generally, the distal pulses are generally either palpable or non-palpable. Other findings that are important are you may get on auscultation in arterial bruit. That implies significant stenosis. You may hear a murmur, pansystolic murmur, or a machinery murmur. I'm sorry. We should actually say that it's a machinery murmur. And that happens in the case of AV fistula. So that's all. In next series, we will be talking about the investigations that we need to do for arterial occlusive diseases, and further the management, both surgical and non-surgical management for such diseases. Thank you.